Okay, so this is the part 2 of the NG lab. I'm going to be demonstrating setting up your feeds and administering one medication through the NG tube. I will preface this by saying typically feeds aren't administered in those NG tubes that are used for suction, but that's what you guys have, so that's what we're going to use. But just so that you guys use that, they're typically used just for suction. In the rare instance, it can be used to administer feeds. Okay, anyway, so we're going to be starting feeds on our patient. I'm going to make sure that I double check the doctor's orders with the type of feed and the rate that it needs to go at, and very typically, like I said in the Panopto, that the dietitian is involved in this as well. She will say the type of the formula that we're going to use, the rate that we're going to run it at, and she usually has guidelines about the flush that you do every 4 hours. Anyone on continuous feeds needs to have a saline flush of or a water flush every 4 hours to make sure that the tube stays patent and to make sure they're keeping up their hydration status. If we don't have guidelines from the dietitian, then you're going to revert to your agency policies, which is typically 25 to 30 mils every 4 hours. Okay, so we've double checked our doctor's orders, and I also want to see if there's any documentation about any allergies that they have to any of the feeds. I'm going to bring my supplies with me. I've got my can of feeds, which is really coconut milk, but we're just pretending. I've got my can of feeds, and I'm going to bring in my feeding bag. There could be 2 different systems. We're using this open system. It's labeled Kangaroo because we're using it with the Kangaroo pump. This one is a double lumen system. You've got one way going, the feeds going on one, and then we've got one is labeled the flush hydration bag. So with this pump, actually you can set it to do your flushes for you every 4 hours, which is quite nice. So we've got this double lumen system connecting up to the tubing. So I need to bring this with me into the room. Okay. So I'm going to come into my patient's room, introduce myself to my patient if I haven't done so already, ask them to state their name and date of birth, double check their armband, and I will ask them if they have any allergies at all, if they've ever had formula before at all. I'm going to position them in a high Fowler's position and let them know that we're going to be starting feeds on them, and then if I know typically how long that will be on, and I'll do some more teaching once those feeds are on. Before you start any feeds or before you do any medications, you want to make sure you go through your checks again. So we're going to double check the length of our NG tube, whatever system we're going to use, whether we're going to check the marking here or we'll measure the length of the tube. That is okay as well. I'm going to wash my hands and put my gloves on to do all this. Once I've checked the length of the tube, then I'm going to get my syringe and I'm going to insert it into the end here, and I'm going to draw back just a little bit, 5 or 10 mils. Insert into my little cup here, get one of my pH strips, and just double check the pH. If their stomach is empty, we want that pH to be less than 5. If they're getting continuous feeds, then the pH could be a little bit higher. So I've checked their pH, and I also want to check for gastric residuals. So I'm going to get an accurate measurement, I'm going to clear the tube of any fluid with 30 mils of air, and then I'm going to draw back and just see how much gastric residuals I get back. I might get hardly anything, so that's okay. We're just going to make note of that, but I might get quite a bit. So I'm just going to keep, whoopsie, good idea to anchor your connection site there. So I'm just going to keep on drawing back. I might get up to 60, so I'm going to disconnect, have another one of these graduated containers to empty out any gastric residuals into that container, and I'm just going to keep on drawing back until I get no more gastric residuals. If I have less than 250 mils of gastric residuals, that's okay. What I'm going to do is re-administer any of those gastric residuals back into the stomach. This is going to help keep the electrolyte balance of our patients. If it's over 250 mils, you need to check your agency policies as to sort of the requirements about that. There might be different requirements as to your steps that you take. For some agencies, if you get more than 250 mils after 2 checks, then you need to stop the feeds, and let the doctor know. Some places are after 1, so we need to make sure. So we've checked for gastric residuals. It's less than 250 mils. I've placed it all back. So now I'm good to go and get my feeds started. So I'm just going to leave this over to the side for a minute. On the IV pole, I'm going to have my kangaroo pump that I'm going to turn on. And I'm going to have my bags up on my IV pole. I'm going to get my can of feeds, shake it up really well. It should be at room temperature. I'm going to get an alcohol swab and make sure that I clean off the top of that tube. Of the can. Open up the can. I'm not going to really do it because we can only put water in these tubes, or else everything gets really moldy. But I'd open up my can, and I would place, I'm just going to use this to pretend these are my feeds, to fill up my bag. If you have tubing that doesn't go into the kangaroo tubing, it has a roller clamp, so we could block off with the roller clamp so it doesn't prime on its own until we're ready. So I've got my feeds, but I also need to fill up my flush hydration bag. So I'm going to put some in the hydration bag. For feeds, we want to make sure, we want to put an amount so that it runs over 4 hours. You don't want to hang the feeds any longer than 4 hours, because that can, it's at risk for bacterial growth. So whatever feeds we're putting in, we want to make sure that those administer over 4 hours. So I've got my right amount in there. I'm going to fill up my label with the patient name and the information and place this on the bag. These bags are changed every 24 hours. And in between the feeds, they're rinsed out with water. Okay, so I've got my bags there. Now what I'm going to do is open up my kangaroo pump. It's a little bit awkward. Okay, I'm getting it caught there. Place it in here. Goes like this. There. Then I can close the clamp. I'm just going to put the end of the tube into my cup that I have here. And then I can keep the settings that I had, or I can clear the settings. So and then you can see that I've got the feed rate. I can set that rate, but first I want to prime up the tubing. So all I do is I press the prime. Done. Prime the pump. It's done. I'm not quite sure why it's going. Telling me disconnect set from the patient before priming, because you don't want it connected to the patient, which I don't have them connected to the patient, so that's good. And I'm not quite sure why it's not going. But so typically this pump will go through the motions of priming up the tubing. Once it's pumped, then once it's primed, then I can adjust the feed rate. Now, the dietitian and the physician has ordered me to go, say, at 150 mils per hour. But when they're getting the feeds for the first time, I want to start that low, so I can set the feed rate. I'm just going to start at 25 and see how he tolerates that first. Enter that amount. And with this pump, this one can do the flushes for me. So I'm going to set the flush as well. Say flush now. Whoops, I don't want to do 200. I want to get it back to 0. There we go. going to flush with 25, or again, this is going to be whatever your agency policy is. And then I can set that to do that every 4 hours. Once I have the parameters set that I want for my patient, then I'm going to connect the tubing up to the end of the tubing. Make sure that you put the Lopez valve on, this 3-way connector. So I'm going to connect the feeding tube up to the end of the Lopez valve, and then I'm going to click run. So I've set it at 25 mils per hour, just low, to make sure my patient can tolerate it. My patient teaching is going to be around letting my patient know that he needs to let me know if he's experienced any symptoms that he's not tolerating the feeds. So if he starts to feel some cramping, some bloating, some feelings of feeling full, some nausea, any symptoms like if he aspirates, some shortness of breath, teaching him to keep the head of the bed up at least 30 degrees while he's getting the feeds in, and for 30 minutes after the feeds have finished. This is fine for patients that are kind of with it. It gets to be a little bit tricky if your patient has some dementia and they're not able to remember those instructions. So that means that you're checking on them quite frequently. Okay, so I've got my feeds going and my flush is set. I'm going to remove my gloves, clean up all my supplies, wash my hands, come over to the laptop, and I'm going to document on the in and out sheet that I've started the feeds, the amount and the rate that I've set it up, and any amount of flush that I administered, and also put it in my nursing notes as well. Okay, so now we're going to do the medication administration. So we're due to give our patient a med. I'm going to come into the room, check on the MAR, pull up the MAR, have a look at that medication. I would have gotten it from the Pyxis already, and I haven't got my supplies ready. At the Pyxis, I would have gone through my 6 checks. My 6 checks of medication rates to make sure that we're just giving the right dose and everything like that. I'm going to bring it in one of these cups because we're going to dissolve it in some water. So I'll do 2 of my checks at the Pyxis, and then come into the patient room. Like I said, pull it up on the MAR, go through my checks again, come over to my patient, and double check his armband, get him to state his name and date of birth once again. Against his MAR, and ask him about any allergies and if he's experienced any reactions to this medication at all. Okay, so I need to get it ready. First, I'm going to wash my hands, put on my gloves. This medication in a little capsule. I'm going to open up the capsule. Place it all in the cup. I'm going to bring over my flush and add in about 20 or 25 mils. Just going to add 15 because I might need to add a little bit more. Use the end of my syringe to stir that up. Some medications dissolve a little bit better in warm water, and you kind of get used to what medications dissolve okay and what medications take a little bit longer. This one is a little bit chunky. Sometimes medications, if you let them sit for a bit, then they dissolve a little bit better. But I'm just going to keep on stirring here. Mix that up. If I'm giving more than one medication, each medication needs to go in its own cup. Okay, I think that's as good as it's going to get here. I'm still going to need my flush. So I'm going to bring this over to my patient's bedside, and anytime I access a tube or line or drain, I like to have a paper towel or something like that just underneath it, because sometimes there's a bit of dripping and it'll save your patient's gown. So before I administer a medication, I need to make sure that I place my feeds on hold, And if the medication needs to be given on an empty stomach, then I should have held these feeds earlier, but we're okay to give it with the feeds. So the Lopez valve allows us to have a closed system, so I don't have to disconnect the feeds or anything like that. I can keep everything connected. I'm just going to take off this connector. Actually, before I do that, I'm going to draw up some flush, 25 or 30 mils. Add it in here. This is saying off. I need to turn it so that it's off to the feeds. So I'm going to inject in my flush. Before I remove the syringe, I need to turn this to off. Again, if I don't, then all that fluid is going to come back at me. So I'm going to disconnect here. Just cap that off to keep that clean. Come over to my medication, draw this up. You can see it's still a bit chunky here, so I'm just going to do the best that I can to draw it all up. Sometimes if there's remnants, I add a little bit more fluid. Draw it all up there. Just get rid of some of the air, but I'm going to make sure that I'm going to point the syringe up because the gravity helps it go down. So come over to my Lopez valve again, take off the cap, and here, point to off. I'm going to turn this upside down just so that the air is up at the top. It helps clear out any fluid that's there. Going to give all my med, make sure I've turned this to off, disconnect my syringe again, draw up my flush, 30 mils, and that helps clear out the rest of the medication. Remove my cap once more, turn this to off, turn this to off, remove my cap, a syringe, and place my cap on. There we go. And then set this to run again if I'm able to start the feeds immediately after giving my medication. And that's it. I would reposition my patient into a comfortable position, remove all my supplies here. These all go in the garbage. If I've got lots of remnants of medication here and this is my flush syringe, I would rinse that out and then just leave these at the bedside. Reposition my patient, make sure he has his call bell within reach, remove my gloves, cleanse my hands, and then document that I gave that medication. And that's it.